Good morning. I have 4 key takeaways from the CNO certification program that I'm going to try to get in here within my 60 seconds. My number 1 was manage by walking around. I feel like I already do this, but always an opportunity to do more. My number 2 was the importance of the CNO in educating the board in quality matters. My number 3 was in succession planning or mentoring others, mentoring those that mentor others. And then my last one, which was really a great learning opportunity for me, was on the cost reporting and the impact of by reducing nursing dollars or on salaries, that the actual savings to the organization may only be 25 to 50 cents on the dollar, depending on what our reimbursement is. So those were my 4 key takeaways. Thank you.
The key takeaways for me from the CNO certification course are the relevant subject matter experts and the relevance of the material that were presented to us in relation to daily aspects of my current role in a critical access rural facility. This will only strengthen my potential for success in my current role. I appreciate this opportunity. Thank you.
I am honored to have completed the National Hospital Rural Health Association CNO certificate program. The last 6 months have been one of personal learnings and professional learnings, especially during a pandemic. I think some of the things that I have taken away is the importance of rural healthcare and the importance of hospitals in rural Iowa, rural America, and the role that we play in caring for people. Without the clinical leaders representing the patients and what is in their best interest, it's so important. I need to say thank you to my cohort. This has been an amazing experience, and also to Iowa Specialty Hospitals for their ongoing support and leadership development. Thank you.
My name is Clay Jordan. I'm the Chief Nursing Officer at Tri-Valley Health System in Cambridge, Nebraska. I enjoy being a part of the Rural Health CNO program, and my key takeaways from the program was part of the leadership building block. I really enjoyed the lessons on self-leadership and situational leadership, and how to motivate staff and work with them individually for the styles that fit them best in the situation. So we'll definitely use that in my practice going forward, and appreciate the opportunities and all the information I learned from the program.
The NRHA CNO course has been extremely valuable in my growth as a nursing leader. Where I find that formal nursing education sometimes falls short is there is not an emphasis placed on rural health. Rural healthcare is unique, and we cannot always be compared to our urban colleagues. This program's content presenters were rural health experts who were knowledgeable and really helped to connect the building blocks to our roles in rural healthcare. Between setting me up with a highly skilled mentor and providing the avenue for discussion and problem solving amongst rural health leaders, this course has helped me to develop a network of contacts to support me in my nursing leadership journey. I am proud to be a part of the first ever NRHA CNO certification cohort.
Hi, my name is Jennifer Jansen. My key takeaways from the CNO cohort was meeting colleagues and being able to network with other rural hospitals. This course has given me a better understanding of cost reports and how to continue to grow within my leadership role. Every module helped me identify my strengths and showed me opportunities of areas to improve on. Thank you so much for this opportunity.
Hey everyone, this is Jeremy Cannon from Kalkaska Memorial Health Center in Northern Michigan. I just want to say thank you to everybody for participating in the NRHA Rural CNO certification course with me. It's kind of cool that we were the first cohort to go through it. For me, the biggest takeaways were, that while rural hospitals and rural healthcare sometimes can be very isolating, that there's a group of peers out there that are experiencing the same challenges as myself. There's no playbook for the pandemic. I truly do believe that some of the most creative people in healthcare are found in rural hospitals. time and time again, I've been blown away with the things that we do here compared to some of our larger peers. I thought the curriculum was great. I learned a ton. I thought the content experts that were able to speak throughout the curriculum were awesome. And again, excellent mentoring, just good people all the way around. So I couldn't be happier. I hope all is well. I hope you stay well, be well, and I hope you stay connected. Talk to you soon. Thank you.
Hi, it's Judy Geiger. Hey, I just wanted to say thank you so much for the opportunity to be part of this collaborative group becoming certified as rural health CNOs. I learned a lot, and I think probably the most important thing I learned from all of you was just what incredible work you're doing and in all of your facilities. And I just so appreciate having colleagues out there that I can reach out to with questions and get your feedback on things. All the presenters were amazing, and I just think this was a fabulous program. Thanks again.
I would like to say thank you. Thank you to Bill and Sydney, the presenters taking their time, and to each and every one of my colleagues in our cohort. It has been an amazing experience to learn from some of the best. The development of a network of resources is invaluable in itself. I've grown as a brand new CNO in this program and will forever be grateful for the opportunity to have attended.
Hey everybody, what a shame we can't be together for graduation. It was going to be a fun time. Hopefully next year we'll get to see each other. I just want to say what an honor it's been to be part of this gang of CNOs. The work you do is amazing. I love it. As an old nurse, and I am an old nurse, I never had that opportunity to be so cross-trained in other areas. And that's what's so effective about this, because obviously nursing is a huge integral part of the hospital, and to have all these other pieces put together in our education, in your education, is really a worthwhile program. I can't recommend this program enough to folks as I speak to CNOs across the country at our critical access hospitals. Thanks for letting me be a part of it, and congratulations to everybody who really did graduate from the CNO first inaugural class. Take care.
Hi, I'm Kate Schaefer. My key takeaways from this program were just how important leadership is in every aspect of the CNO role. I just want to say thank you to Bill and the team for taking time to do this program. It was very beneficial. Thank you.
Hello, my name is Katie Peterson. I'm so thankful that I was able to be part of this first CNO cohort. I've been in my role as Chief Nursing Officer for more than a decade, and I would have loved to have a structured program like this all those years ago. Even taking it now was a great refresher and time well spent. I especially like the areas that discussed finance and board relations, as those are some of the most difficult to learn on the job. Despite being virtual, the breakout sessions allowed opportunities to interact and network with the entire class in smaller groups. I made some great connections that I know I will maintain in the future. Thank you for having me.
Hi, I'm Kim Sison. I am just happy to be reporting here as we finish up our CNO certification program through the NRHA. It's been a very interesting program. I think a few key takeaways that I have found. It's nice to see that there are a lot of other leaders in rural healthcare in very similar situations that I find myself in, especially as a new CNO. It was a very supportive environment. It's nice to see that my struggles and challenges are not unique to just my own hospital. I got a lot of really good information, useful ideas, ways to improve upon our opportunities, and I found it to be a very nice group of colleagues with a lot of great information and knowledge from various different backgrounds, and I thought that was helpful. The speakers who presented to us, the information was very robust. I found it easy to get a hold of and make useful in my day-to-day operations, and that's really what made the program very helpful to me. I will refer back to all of the PowerPoints and the information and the knowledge that I've pulled from this program alone, I think will help me as I move forward in my role. And I thank everybody for letting me be a part of this.
There are so many takeaways from this program that I have a hard time picking a few, but the community involvement part, the part about board involvement and physician engagement, and of course the financial part was a great help to me as I get ready to start my new position as a CNO. But the most important thing I felt was our meetings where we got together and discussed things. Having a network of people was a great help to me, and I look forward to continuing that. Thank you.
This course has taught me some necessary knowledge on leadership to be a top-performing rural hospital leader and how I can help my facility to grow. I learned about the different cultures and styles of leadership in healthcare and the importance in strategic planning and a shared vision, how to decrease outsourcing and outmigration. I also got a better understanding of the cost report and the role I play in it.
Hello, my name is Marlene Elliott, and I'm the Chief Nursing Officer at Cooley Medical Center in Grand Coulee, Washington. I feel so blessed to have been part of the first NRHA Rural Chief Nursing Officer Certification Cohort. As a Rural Chief Nursing Officer, we face many challenges that are unique to rural healthcare: recruitment and retention issues, financial challenges, and limited resources, to name a few. Our hospital is an independent public hospital which does not have an association with a larger organization. At times, one can feel a bit isolated without a network of support. The CNO cohort has helped me develop relationships with other rural health CNOs that face similar challenges. To have this network of professional nurses has been invaluable. The NRHA certification cohort has helped me broaden my view on how to tackle these challenges through better understanding of how to partner with the executive team within our organization, working together to build a strong strategic plan and to share that vision throughout the organization itself. Bringing the knowledge that I have gained through the certification coursework will help elevate my organization to the next level. I'm very excited to continue learning through the NRHA and look forward to more continuing educational offerings in the future. Thank you.
Hi everyone, this is Roxanne Stell. I'm the CNO of Abraham Lincoln Memorial Hospital in Lincoln, Illinois. And I just wanted to send this little video to tell you what I enjoyed about the CNO certification program. The biggest thing that I enjoyed was getting to know my fellow colleagues in the program and collaborating with them. As we're going through this difficult time in our country, it's nice to know and to understand that we're not alone, and to really get to know all of you and feel that support. So I appreciated that very, very much and really enjoyed that portion and our breakout groups for the program.
Hi, this is Sean Nethery, and I just wanted to give you a brief takeaway from the CNO certification program of what I learned. I think my biggest takeaway was the financial and budgeting parts, because that's where I was the weakest. And now that I have taken the program, I wouldn't say I'm an expert, but I do feel more comfortable doing those things.
Hi, it's Steve Olson from Carthage Area Hospital in Carthage, New York. I just wanted to thank the leaders from my organization for the support to attend the course, and also thank you to Bill and Sydney for organizing this all. The course was interesting to me and informative, and it was the best part to me was interacting with the peers, and I can see firsthand that some of our challenges are in New York are exactly the same as they are in other parts of the country, and it was a useful perspective when things are kind of crazy right now. I also thought the information about budgeting and staffing were particularly helpful and relevant in some of the things that we're dealing with now. Thank you.
Hello, my name is Sue Lynn Mester, and I'm the CNO at Childress Regional Medical Center in Childress, Texas. When I first saw the information about a possible rural CNO certification with Bill and the NRHA, I knew I wanted it. I have been fortunate to have been involved with many NRHA events, and I knew this would be a quality program. Education specifically targeted for the rural CNO is so needed, and I knew there was no one more qualified than Bill and the great team at NRHA. I knew Bill and have interacted with him through the years at many NRHA events where our paths have crossed. I immediately reached out to him to see what I could do to help him and how could I get in the inaugural cohort of this course. It just took off from there. The education presented in this great program will serve me for the rest of my career. Rural is not just a smaller version of urban, and education that is so often offered for hospital CNOs does not translate to rural. Every single element of this program was on point and relevant to the jobs we do every single day. I would encourage any and all rural CNOs to sign up for this course and get the certification. Thank you so much to Bill and Sydney and to NRHA for the tireless work you do in supporting rural healthcare workers across our great nation.